concussion, and head injuries. Concussion is a brain injury that can result from a blow to the head or from sudden, violent movement of the head, such as in whiplash. A concussion is a serious matter. Common signs and symptoms include headache or head pressure, feeling stunned or dazed, nausea, dizziness, visual disturbances, sensitivity to light and noise, confusion, difficulty remembering, and change in level of consciousness.
Ow!
Claire, you okay?
No, I really hurt my head.
Here, sit down. Do you feel nauseated? Are you dizzy?
Dizzy a little.
What about your vision? Can you see okay?
Wow, things are a little bit blurry and these lights are making my head hurt worse.
I think you may have a concussion. I'm trained in first aid. Do you mind if I give you some help?
Please.
Let me call the paramedics for you. Just be safe.
Head injuries. Other head injuries can include a skull fracture and a general head wound. Signs of a skull fracture include a deformed area of the skull, a depressed area in the bone felt by touch, or blood or fluid coming from the victim's ears or nose. If the victim is unresponsive but breathing, and there is no chance of a neck, back, hip, or pelvic injury, move him or her into the recovery position. Monitor breathing and be ready to give CPR if needed. Do not clean the wound, press on it, or remove an impaled object. Cover the wound with a sterile dressing. If there is significant bleeding, apply pressure only around the edges of the wound, not on the wound itself. Do not apply pressure if you feel bone fragments move. Do not move the victim unnecessarily because there may also be a spinal injury. Call 911 and stay with the victim. For a head wound without a skull fracture, replace any skin flaps and cover the wound with a sterile dressing. Use direct pressure to control bleeding and put a roller or triangle bandage around the victim's head to secure the dressing. Seek medical attention if any of the victim's symptoms worsen or if the victim later experiences nausea and vomiting, persistent headache, drowsiness or disorientation, stumbling or lack of coordination, or problems with speech or vision.